presentations and lectures and events hosted by Health Media. In fact, they got us in touch with our wonderful guest that we're having on today, Dr. Joseph Bosiljevac, who is a medical doctor who took the time to really delve into what I say is science, what I say is good medicine, what I say is evidence-based medicine, where we actually combine everything that's known to bring together in his practice longevity medicine, where he's keeping people at their peak and really healthy as the years progress, as well as younger people too. Is that correct, Dr. Joe?
Oh, definitely, because again, the ravages of our environment occurs as soon as we're born.
And also, very often I've had a lot of patients who even were younger, and they were couples, and they were dealing with something like infertility, and using complementary interventions such as looking at what nutritional deficiency they have can make vast differences.
It certainly can. It plays a big part, and those are the areas that are not recognized well by conventional medicine.
And why not, do you think?
Here's a thought. Everybody's supposed to have a primary care doctor that kind of oversees everything. But what's hard is in conventional medicine, you've got all these specialists, and the specialties are so involved, there's a lot to learn just in the specialty. So you got a patient, he's being taken care of by 3 or 4 specialists for whatever reason. It's hard for a primary care doctor to stay up on all that. And it's hard from one specialist to realize what he's doing may be interfering with what's going on with another specialist. And that's where, in my opinion, in a longevity practice, this is what you need, is somebody that can look over things and lay it out on the table where you can understand it as a layperson. You'll make the right decision if you understand it well. But that's what you need, is a generalist who can kind of help oversee bits and pieces that are coming from various specialties.
That's so well put. Even now, the field of gut-brain is exploding in terms of medical literature. And yet, if you went to a gastroenterologist, they may not even ask you what you eat, shockingly enough.
That's very true. And, what's difficult for me is I have a lot of CEOs in my practice that entertain every night. And I don't care what restaurants you go to, you don't have any control many times of things that are added to the food or where the food came from. Plus, you've got empty carbohydrate calories from alcohol. And that makes it very difficult. That's just an example of how the environment and our diet can affect things.
And, of course, stress. Well, what would you recommend to that patient if they came in? Obviously, they're not starving. They can afford food, but it's their choices that could really use some revision.
That's what I look at, is using some objective data that can tell the patient exactly which direction they're going. A lot of this is blood work, and the blood work also is comprised of looking at many areas of hormones, or what I call the hormone orchestra. You've got all these sections, sex hormone section, growth hormone, thyroid, all these places that are playing a part. But this is that, and another one that I find is looking at a body composition scan that tells a patient what is going on with his body composition, not just looking at number of pounds. I've had patients that'll come in and we'll get them started on a program. 3 months later, they come back and they go, "Doc, I'm so frustrated. I'm at the same weight I was." We get them back on a DEXA scan, and they've gained 8 pounds of muscle and lost 8 pounds of fat. And I'm going, this is the direction you need to go. And those sorts of things are what help patients, I think, something objectively that helps them understand what they're doing and how it's doing for them.
Well, to make that kind of change with a patient who comes to see you at the Longevity Center where you are located, and I imagine that's in Manhattan, is that true?
Yes, I've got an office on Wall Street. I've got one on 79th and 2nd Avenue also.
Okay, so definitely in Manhattan. And what would you usually initiate in terms of a protocol? Do you give them specific diets? Are there supplements that you recommend?
Here's what I would say as far as an overall program. Diet and exercise. There's 80-85% of your ball game right there. Okay? Then you look at any supplements, any chemical deficiencies where additional supplements can come in. And then hormone optimization is truly a key, because this is where, when you see the premature drop in hormones, this is what's causing problems. A typical example is the so-called syndrome that occurs with patients. They turn 50, now they need to be on something for cholesterol, they're having trouble with their blood sugar. Both of those things are strictly hormone related to testosterone in a male as well as thyroid hormone. So that is a very important aspect to look at.
Wow, that's so true. And I want to tell you, listeners, that you are listening to Herbally Yours on the voice of Nassau Community College. Right here on 90.3 WHPC. I'm Ellen Kamhi, naturalnurse.com, and my guest today is the author of Surviving Cancer, the Use of Complementary and Alternative Methods in the Treatment of Breast Cancer, Dr. Joseph Bosiljevac, who is both a medical doctor and a PhD in natural health. What a great combination. So when you test for hormones, so many patients show me their blood work, and they say, oh, my doctor tested for thyroid hormone, and all the doctor tested for was something called TSH, which is thyroid stimulating hormone that does not even come from the thyroid.
Yeah, it's, what I call, this is fine-tuning, okay? For instance, a patient comes in and his so-called testosterone levels will be in the normal range, but his blood sugar is out of whack. His cholesterol is high. Well, a simple example, cholesterol is used by the body to make cell membranes, neurotransmitters in the brain, sex hormones, vitamin D. So if those levels are suboptimal, the cholesterol shoots up. I see this all the time. You optimize the hormones, and the cholesterol comes down without any medication. It's the sort of thing I tell a guy, he's 55, and he was told, well, I got to be on this cholesterol medicine. And I look at him and I says, when you were 35, did you need that? No. And I go, well, then what has changed? What's gone on here? And a lot of that has to do with hormone balance as well as body composition, losing our lean muscle mass that we had when we were in college.
Well, what do you tell, for instance, your busy managers that you talk about coming in, CEOs, how do they incorporate more exercise into their life?
It depends on the individual. If you've got to get, you may have to be aggressive to get some body fat, the so-called android or the belly fat. That's what's dangerous. To get that down, you may need to be a little bit more aggressive. But I also have a group of guys, they're retired military special service guys. And these guys have been through a lot of heck, and their bodies are falling apart, and they start working out harder and harder, and they ache, they hurt, and they've actually developed a program where a guy like that can work out 15-20 minutes 3-4 times a week, and that's all he needs. It's not like you have to be out there exercising 2 hours 5 days a week, that sort of a thing. So it can be determined individually what will be helpful for that person.
And then do you send them to a gym, or do you instruct them, or, how is the protocol managed if people come to your practice?
What I look at is I don't have a cookbook. I like to spend time with patients and determine whatever we're going to do, let's make it let's make it doable for you, something you'll comply with. That's what I look at. And some patients are able just to do push-ups, sit-ups, and climb stairs at home for their workout. Some need to go to a gym. So there's different ways of doing that.
Depending on the individual. So you have very individualized practice. Now, your book, Surviving Cancer, the use of complementary and alternative methods in the treatment of breast cancer, is amazingly well referenced. You have a giant section in the back of the book just of references, and these are not from the New Age Journal. These are from mainstream medical literature, like the Journal of the American Medical Association.
And here's what I found out. When I look at Donna, what worked with her? And basically, Donna dramatically changed her lifestyle. No junk food, no processed food. That was a big part of it. But also detoxification. I think a lot of what she did helped detoxify. And here's what I look at. If I'm looking at somebody with cancer, I'll tell them three things. This is where we're going to look at. Number one, cancer loves a toxic environment. If you don't change that toxic environment, that's when things come back. And this is what you see in conventional medicine many times, because they don't change the toxic environment that may be causing that. The second thing is cancer loves sugar. Conventional medicine doesn't rely that much on diet changes with the patients that have cancer. The last one is cancer hates oxygen. So when you talk about the so-called biooxidative therapies, which are intravenous hydrogen peroxide or ozone, those things are very effective. But you throw that out to a patient who says that to her oncologist, he'll throw his hands up in the air and he'll go, oh, no, don't do that. It may interfere with my chemotherapy. That's where we're at.
That's true. Well, more of those doctors should be studying with you because, as indicated in your book, there's, so much great references that they can rely on. Now, of course, even your patient that you're discussing in this book, she did have initially surgery. And, it wasn't that she just relied on diet to reverse a stage 3 cancer.
Right.
Because I've actually seen people make that choice, and I don't think it's the wisest choice because I have not seen great outcomes with that.
Right. And so, again, it's a combination of balancing between conventional medicine and alternative medicine. It's just that conventional medicine, they just shy away from anything. Don't do that right now while we're putting you through this chemotherapy, and they lose ground because of their nutrition and chemical demise.
That's so true, and it's wonderful that people have you to refer to if they're looking for a more balanced approach and, truthfully, a more evidence-based approach.
Well, it's fun taking care of patients. That's all I can say.
Well, I want to thank you so much for being our guest today, Dr. Joseph Bosiljevac, and you can find him on our website at WHPC because this show will be archived. I'm also going to send him a link for his website if he'd like. And I'd like to thank you, listeners, for tuning in once more to Herbally Yours, produced in the studios of 90.3 WHPC, Nassau Community College, Garden City, New York. For further information, email us at whpc@ncc.edu. This is your host, Ellen Kamhi, naturalnurse.com, inviting you to join us next week for another edition of Herbally Yours. Until then, stay healthy.